But I wanted to begin tonight with some serious concerns being raised over a national mental health crisis hotline. Nick Reisman joins us now from the state capitol. So, Nick, I know 988 has been live for a little over a week now, but I understand that mental health advocates' enthusiasm has been somewhat tempered. What can you tell us?
Hey there, Susan, and that's right. Certainly mental health care advocates in New York are cheering 988 finally being available, but they say long-term resources are needed.
Association for Community Living Executive Director Sebrina Barrett says the new 988 line for people in a mental health crisis will be a vital tool for helping people in need. But she's worried New York is not doing enough to reach its goals of supporting mental health care.
When you have experienced decades of underfunding, it's not just flipping a switch and catching up.
New York is spending millions of dollars to bolster 988, funding that dovetails with the creation of crisis stabilization centers to help people with mental health needs. It's part of a changing approach to mental health programs.
What we're concerned about is, do we have the infrastructure, do we have the workforce and the resources needed to help sustain what we're going to see as far as the mental health need?
At the same time, Barrett points to rising inflation costs now outpacing even the spending increases New York lawmakers and Governor Hochul have approved.
We're going to be looking to the state for even more resources so that we can stabilize the system and then grow to meet the need that's coming.
Glenn Liebman, the CEO of the Mental Health Association of New York State, calls services like 988 as well as the crisis centers a step in the right direction.
That is a positive trend, but I think inevitably it comes down to services as well and the long-term impact for people.
But whether this sea change in mental health programs can be successful remains to be seen.
It's still evolving. We have to wait and see, and hopefully this will be something that will ultimately be positive and provide positive outcomes for people who are in crisis.
Now, we did reach out to the State Office of Mental Health, and a spokesman there says that already the 988 helpline has proven to be really kind of a vital resource for people who are in a mental health crisis, and they do plan to continue working with mental health care advocates in New York to improve it. Susan?
So, Nick, why are advocates calling this a sea change in mental health care?
Well, one thing that mental health advocates in New York have been really concerned about is ensuring that people who are potentially in a mental health crisis receive not just the care that they need, but also are not put in danger when someone is responding to them. So perhaps in the past, when you would have a member of law enforcement or the police come and respond to an incident, and when someone is in a mental health crisis, 988 and other services that are also coming online right now is something that could basically provide alternatives to that response.
Another question. Both of your guests said that more resources were needed. Is there money? How much money are they talking about?
Right. One thing that's really concerning for a number of advocates right now, as you just heard, is inflation, the rising cost of doing virtually everything right now. It's just getting more and more expensive to deliver these services. All of that being said, in the state budget over the next several years, they are going to be increasing funding for these mental health programs going forward, especially for 988, essentially doubling the budget by millions of dollars over the next several years. All of that being said, a lot of the mental health funding has been predicated on federal dollars coming in, and that's money that is not necessarily going to be there next year.
Nick Reisman reporting. Thank you.